Next up, President Trump making the opioid crisis a top priority early in his administration.
This is a total epidemic, and I think it's probably almost untalked about compared to the severity that we're witnessing. Solving the drug crisis will require cooperation across government and across society, including early intervention to keep America's youth off this destructive path. We must work together, trust each other, and forge a true partnership based on the common ground of cherishing human life.
And now this, CVS Pharmacy today doing its part, announcing it is limiting opioid prescriptions to a 7-day supply. It is the first national drugstore change to restrict how many painkillers doctors can prescribe to patients. CVS stock closing the day higher, up less than 1%. Now to a state where the opioid crisis is killing so many people that cold storage trailers now have to be used as morgues. We've got Ohio's Butler County Sheriff Richard Jones with us. Good to have you on the show, Sheriff.
How you doing?
Sheriff, should other drugstore chains follow what CVS is doing and limiting access to opioids?
Nope. I don't believe that the CVS is. I don't believe it's going to solve anything. The people that are getting these 7-day supplies, these are the people mostly that work every day and have pain and have surgeries. The senior citizens. That's not the issue. These people that use the drugs and are addicted to drugs are just going to go to a street drug. They're not going to go get the pharmacy drugs. Most of us in the field don't believe this is going to stop much of anything, period.
Wow, that's interesting. Sheriff, according to the Ohio Department of Health, the number of opioid-related deaths skyrocketed in your state from just under 300 in 2003 to over 2,000 in 2015. I mean, that's a big jump over that 13-year period, Sheriff. What can be done better to fight this crisis?
We spend 80% of our time or our money and our resources on the treatment of those that are addicted to drugs. We spend 20% on education. We need to reverse that. And when you talk to the people in the field, we need to spend 80% on preventing people, like the President of the United States just said on your show, and like Nancy Reagan said, yeah, but we're not working both ends. The people that are addicted, it's sad to say, but it's going to be very hard to stop those people and get them turned around. But we're not even working on the kids that are in grade school. I've had 3 babies born in my jail. The last one was born in the toilet. These are to addicted mothers, and I have 12 women pregnant in my jail, and of the 12, they have 35 babies, and they're all addicted mothers. And it's that way all over the country. But Ohio is taking the bullet. Period.
You know, Sheriff, what are we in the media missing when it comes to what you and your officers have to deal with on a daily basis with the opioid crisis?
Here's what you're missing. It's so deep-rooted, and when you talk about the Narcan that revives them, or you talk about the pharmacy going to cause you to have a 7-day supply, we're not working on the root problem. And the root problem is 76% of all the illegal drugs come to the United States. It's supply and demand. They run the opium, China does, to Mexican border so it can come over to the United States. We're doing something by stopping it from coming in, but it's what we refer to as the giant balloon effect. You squeeze it over here, it goes over there. We're not addressing the problem.
So it's a border security issue, the drugs coming over the border. Sheriff, it's so good to have you on the show. Sorry, we ran out of time there. We want to have you on soon to talk about this. You're terrific, Sheriff Jones. Thanks again.